we have seen during the COVID time, during last 2 years, people were wearing masks. The incidents and the people remain indoors. So the incidents of asthma had come down. Now with the schools reopening up, people roaming around, and people have shed off their masks. The most important thing is that they come out in the public area, they are exposed to certain dust and other things. The incidence of asthma is again increased, especially last 2 months. It's basically people have become much more laxed. They are saying that since we are COVID free, these asthma patients which were there, they got exposed to a number of allergens or dust particles and going to public area, so they're more prone for infections. Plus this heat, the heat itself is also causing a big rise in asthma cases these last few days. At this stage, with things opening up, the traveling increasing, people coming to Goa as tourists, the business opening up, I don't think so. We should go for mastery. We should hold on for some time
So,
till we take a final decision of without being a mass.
so the flights have commenced. A lot of tourists are coming in. Domestic tourists are also pouring in the state. Somewhere there is an image in the tourists that Goa is not mask free. You think there need to be a counter at the airport to check every passenger coming into the state?
No, it's not we need to check every person or tourist coming into Goa should wear a mask or we should wear a mask. See, it's not the government who should act. We should take the responsibility ourselves. All of us should take the responsibility. Fine, I'm going to wear a mask. I'm going to prevent the spread of COVID. If I don't wear a mask, I myself might be a victim of COVID. So it's our own responsibility. Government cannot stand and monitor each and every person here. So we need to take a responsibility. Yes, government can always help by, like you said, putting up certain counter that or promoting in the media that please continue wearing a mask. Recently, there was an order passed by the collector that mask wearing should be continued in the public areas, and we should follow that.
Thank you.
With the kind of trend going on in certain part of India, the COVID cases increasing over last 15 days to 20 days. We might see a fourth wave, maybe June and July. But this fourth wave can be prevented if everyone wears a mask in the public area. Definitely, this can be prevented, provided the uses of mask is continued. But if the mask usage is discontinued, we might see the fourth wave, and it might. We don't know how it go, how it may act, how kind of severity it might be later on. We just cannot predict that. But yes, with the usage of mask, we can definitely prevent the fourth wave.
So the entire medical fraternity of Goa.
Definitely, the usage of mask has declined the asthma cases. Not only declined the asthma cases all over India, but also the incidence of tuberculosis has come down with the usage of mask pan India.
But now with the people not wearing masks, the cases have gone up significantly.
Yes, the attacks for asthma have gone up. People are coming with attacks of asthma. They were fine during this time, and they had stopped using their reliever medications, inhalers. So, since the asthma case is going up, we have been advising patients to start taking their reliever medications or the preventive medications, the preventive inhaler, the steroid inhalers, which act very well in the long term to prevent the attack of asthma.